Well, deaths due to COVID-19 have been surging in Grant County in recent weeks, and about half of them have been associated with long-term care facilities like the one behind me. Meanwhile, employees with the health district say they're just swamped trying to deal with everything related to coronavirus.
Our job is not fun. It's just gut-wrenching. It's day in, day out frustration.
Teresa Atkinson is the administrator of Grant County's health district. She says dealing with COVID-19 has been nothing less than taxing on her small staff.
But I get to talk to the people on the phone. My staff talk to the people on the phone that are sick. And if our public spent a day in our health district talking to people that are sick, I think they'd have a very different perspective on what COVID is in our community.
And like elsewhere, COVID is on the rise here. Over the last 2 days, Grant County has reported 18 more deaths tied to coronavirus. 7 more deaths are pending. 26 deaths were reported in the county last month. That compares to 4 deaths in each of the last 2 months and 8 deaths in August. And local nursing homes and long-term care facilities are feeling the brunt too. About half of all the county's deaths have been tied to care facilities.
It's our community that's bringing it into these facilities. It's not the facility's fault that they're dealing with what they're dealing with.
And remember the large wedding that was reportedly attended by 300-some people outside of Ritzville last month? The Grant County Health District says close to 50 local cases have been tied to the event, and some staff members at local long-term care facilities attended that wedding, according to the district. Now, while outbreaks at the facilities happened after the wedding, the health district can't say for certain that the employees who went to the wedding spread the virus.
And it has likely resulted in deaths in our community.
In the past 3 to 4 weeks, our census has jumped dramatically. We do attribute a lot of that to COVID.
Samaritan Healthcare, the hospital in Moses Lake, says they've been holding up so far. They've had high patient numbers, but haven't hit capacity and haven't had to divert people elsewhere. But while Samaritan is taking COVID patients from smaller hospitals, they've also had to send patients who need more advanced care elsewhere.
We do everything we can to keep them here, but we also know our limits, and when we need to send them, we will.
The health district, meanwhile, says they've been, quote, underwater with case counts. Staff are reprioritizing investigations. That, while some people who the district believes may have been exposed won't answer their calls.
And it's just so sad because this is my hometown. And I understand how hard this is for folks, but I also know if we just let down our guard, COVID's going to take over. And COVID right now is taking over.
The district adds that strike teams from the state have also come to Grant County to work with healthcare facilities. In Moses Lake, Taylor Vito, KREM 2 News.